This voiceover is on the female breasts. Breasts are what we would consider to be secondary sex characteristic, which means you can distinguish males from females. Would you disagree or agree with this statement? Female breasts serve only the function of producing milk for the offspring. While female breasts do have a lot to do with female sexuality, both men and women get wrapped up in the mysticism of them. However, most of breast tissue is fat. And no, you cannot exercise to increase the size of your breasts because exercise reduces our percent of body fat, which would decrease the size of breasts. Breast size is mainly determined by heredity. And it seems like women are never happy with their breast size. They're either too small or too big. They say that breasts are just as sensitive whether they are large as they are small. And I might argue that small breasts are even more sensitive because the nerve endings around the nipple are more compact and would lead to even greater sensitivity. And while we're talking about size, size has nothing to do with the capability of a woman being able to breastfeed. We will be talking more about that a little bit later. The 5 parts of the breasts are the nipple, and in that it contains the nerve endings. And nipples can be flush with the breast tissue. They can stick out, or they can even sink in. All of those would be normal configurations, and when exposed to the cold or becoming sexually aroused, the muscles around the nipple contract, causing the nipple to become erect. The areola is the dark colored area around the nipple. There are also sebaceous glands around the nipple in the areola, as that will help with breastfeeding. And it's not uncommon for hairs to grow around the areola, and this would be determined by the amount of hormones that that particular female has. Next are the mammary or milk glands, and their purpose is to produce the milk. The milk ducts would lead the milk that's made in the mammary glands through the milk duct to the nipple. And as I mentioned earlier, most of breast tissue is fat. The first picture you see here is that of a breast of a child. You can see the rib cage, the muscle, and then a little bit of fat and very small amount of mammary glands, very short milk ducts leading through the nipple. Next is the breast of an adolescent. B would be that of an adolescent. You can see there's more fatty tissue here, more mammary glands, and longer milk ducts. Clear to the right is that of a breast of an adult. Again, more fatty tissue. And then in the very bottom, and I can see that adolescents got misplaced there, but you could see what the nipple and areola would look like. On this slide, let's start on the right. That is the breast of a pregnant woman. And as you can see, it is increased. The woman's breast does increase in size once she becomes pregnant, as it's preparing to lactate if the woman would choose to breastfeed. You can see many more mammary glands and, of course, longer milk ducts. The middle breast is that of a lactating or breastfeeding woman. You can see those mammary glands are filled with milk. And then the breast on the left is that of a postmenopausal woman. As you can see, the skin becomes less elastic, so sagging occurs. There's less percent body fat as a woman gets older, so you see smaller breasts. Lactation is the process of milk production, and this will occur anywhere from 2 to 3 days after a woman gives birth. And if a woman wants to breastfeed, she needs to put the baby to the breast right away, because even though her milk won't come in for a couple days, that sucking will start the process. Also, the baby will get a product called colostrum, which is very high in antibodies that mothers want their babies to have. So even though they aren't getting milk, they will get a very rich nutrient. A lot of women who even don't want to breastfeed might want to put the baby to the breast for the first few days, so the baby will get that colostrum. However, if they do that, then they will have a problem on their hands because the milk will come in and they will be engorged, and then they will have to stop that process if they don't want to breastfeed. They used to give women a shot that would reverse the process if they chose not to breastfeed, but they don't do that anymore because that shot was causing women to die. There are two hormones involved with the lactation process. That of prolactin, that stimulates the milk production, and oxytocin stimulates the ejection of milk from the breast, and that's caused by sucking. As the baby goes to the breast, as they begin sucking, to me it felt like pinpricks. Sometimes they call it a tingling sensation. You can feel when the milk is going to be let down. It takes a couple minutes, but once the milk comes out to the nipple, you can feel that sensation. We will be doing the pros and cons of breastfeeding, so you will have that to look forward to through the threaded discussion part of our class. And then this slide just shows that the hypothalamus is in the brain, and that starts the whole hormone process. We'll learn about this more in Chapter 2 when we talk about female hormones. But the hypothalamus stimulates the pituitary, which stimulates the production of both prolactin and oxytocin. Again, prolactin, pro or for milk production, and oxytocin for milk release. And sucking is the stimulus. Here's a picture of an Afghanistan woman. She had 2 babies, and she did not know that she could breastfeed both babies. In their culture, boys are more prominent. So she had a boy and a girl and chose to breastfeed the baby boy. And as you can see in this picture, that baby boy is a healthy baby, getting what it needs from the mother's nutritious breast milk. The little girl on the left, I don't know whether she has unsafe water in her bottle mixed with formula, or maybe the formula is half the strength, because formula is expensive. And so they may have just mixed it half strength, or they might have even put cow's milk in this baby's bottle. And babies shouldn't have cow's milk until they're a year old, and then it should only be whole milk because they need the fat in milk for brain development. But unfortunately, this baby girl is suffering from a protein malnourishment called marasmus. Her little body is literally wasting away. And I understand that this baby died a couple days after this picture were taken. If that mother would have only known she could have breastfed both of her babies, she could have had 2 healthy babies. Because women are often dissatisfied with their breast size, they will choose, if they're small breasts, they will choose to have them augmented. And throughout the years, silicone was the prevalent way to do this, and it was proven to be unsafe. Dow Chemical, the company that was making these, promoted them knowing they were not safe for women. The problems were they would sag, they would burst, they would become lumps. A woman could not do a breast self-exam because she wouldn't know if the lump was the silicone or cancer. A woman could not breastfeed with them. When they leaked or burst, that solution would get into the woman's autoimmune system and cause her to become ill. Now today you may see some women or hear of some women who have silicone implants. Those women most likely are women who have had their breasts removed, whether it be to prevent them from getting cancer or because they had cancer and had to have a mastectomy, which is the removal of one breast, or a double mastectomy. So if you do hear of a woman that has silicone implants, know that they still do that. That woman would be typically older. She would not need to breastfeed or want to breastfeed, and she wouldn't have to worry about doing breast self-exams because she has the tissue in her breast removed. Today, most likely, they will put a plastic envelope with saline solution in it for the breast augmentation. This requires surgery. They'll make the incision at the base of the breast so you really can't see it. These women can breastfeed and they can still do breast self-exams. Here is a picture of how you might see such an implant. And it might even act as like today's push-up bras, that it would lift the natural tissue in the breast so what's on top would look more normal. Here's a picture of a woman who had breast augmentation. You can see what she looked like on the left, and then after she had the breast augmentation. This woman, it wasn't that her breasts were so small, they just were sagging quite a bit. And then here you see a picture from the side. Here's a picture of an actress. Her name is Kari Wuhrer. She felt like she wanted to have her breasts augmented because as an actress she wanted to have nicer breasts. Well, after she had the breasts and had problems with the silicone, she decided to have them removed. She also felt that there was more attention being placed on her breast than on her as a person. So now you can see from her quote, "I want people to see me for who I really am. I want to learn to love every part of me without apology." Here she was as an actress with her breasts augmented. And yes, they do look nice, but if they cause health issues, then that makes a woman think twice. Here she was going through the process of having her breasts marked to remove them. And then she even had an unboob party. And you can see the picture clear to the right is the doctor or nurse rolling her out after the surgery. And then some information about if breast implants are safe. That was probably her determining factor. She did not feel that what she had was safe. Today, most breast implants are safe, or at least safer than it was back in the early 2000s. Just as many women are dissatisfied with their breasts being too small, many are dissatisfied because they are too large. And it's a real health issue for these women. The bras they have cut into their shoulders. They have to be bigger bras to hold their breasts so they aren't as pretty. Women get terrible back aches. And just large breasts can be uncomfortable, especially for women athletes. It's not unusual for a woman who's an athlete to wear 2 or 3 sports bras to just push their breasts as close as they can into the body so they don't stick out. Plus, smaller breasts may be more sensitive because of the nerve endings being less dispersed. Today, breast reduction surgery is much more refined and successful than what it was in the past. And so the women that I have known who have had breast reductions have been very pleased with that decision. And insurance will pay for a breast reduction in most cases. When it comes to breasts, breast cancer is our largest concern. And with any form of cancer, early detection is the key. You can live without your breasts, but if you don't catch breast cancer early and it spreads to vital body parts such as your lungs or skin, then you can't live without those body parts. About 46,000 women die each year in the United States, and they do not have to if it's caught early. And men, you are not immune. About 240 men also die annually. It's just less prevalent in men. Plus, because men have less fatty tissue, if they were to get a lump, they would likely notice it a little bit earlier. Breast cancer in women is the number 2 cancer, second to lung cancer. And they say overall 1 in 9 women annually will get breast cancer. You are at greater risk if your mother or sister has had breast cancer. And so other risks are if you started menstruating earlier than age 12, if you waited till after you're 30 to have a child, never having given birth, if you've been on an artificial hormone replacement therapy that can help the symptoms of menopause, but it does put women at a greater risk of breast cancer. And then those women who are heavy drinkers put themselves at risk for breast cancer. There's also a gene mutation that some women can inherit. So be sure you research this information, knowing that half of breast cancers before age 38 are a result of this inherited gene mutation. So if you have that in your family, you certainly would want to take precautions. And remember, it's not the cancer in the breast that causes death, but when it spreads to vital body parts. Here's a chart that shows the chances of having breast cancer.